Hey everybody, when you say you're going to do a part 2 to something, I guess you just got to follow through. So this is part 2 of who makes a good patient for a consultation. Just to sum up from the first video, which hopefully you'll watch in full, but you want to be your best weight, you got to be nutritionally optimized, and we want you to work on some areas, especially your core and your gluteal areas. So other things that make you a good consult is if you have some medical issues such as a cardiac problem or a heme issue, meaning maybe you have an irregular heartbeat or you've had some atrial fibrillation or some other issues, or if you have a history of a blood clot or a family history of a blood clot, that you've already spoken to your hematologist and your cardiologist and have touch base with them, let them know what your plan is for plastic surgery, and make sure that you are an adequate candidate. Because I may think you're a good candidate, but if you're not going to get cleared, then that consultation was just unfortunately a waste of your time. Another thing that makes a patient a good consult when they come to me is having a general idea of what areas mainly concern you. So the hardest consult for me is when a patient comes to me and they say, I want everything fixed. And there's really no direction. They don't really have any sort of focus on what wants to get fixed. And when I see my patients, this is really a team effort. It's a collaboration. And we're not going to get everything fixed in one surgery. And so, Rome wasn't built in a day. You didn't lose your weight in a day. Likely, I'm not going to be able to fix you in one day. So having some goals in terms of the areas that are a priority for you, so that helps direct the consult and sort of focus things. And then we can come up together with, a plan that's going to touch on all of your areas of concern, and just sort of helps balance the consult so we're not just sort of all over the place and multiple plans. It just helps things out a lot. Having realistic expectations as well is also something that's really important, and probably one of the most important things and the hardest things for me to talk about with patients. And so, finding patients that maybe look a little bit like you is sometimes helpful, but a lot of patients just, unfortunately, sometimes I'm not going to be able to deliver on what they want. So, expectations, goals are really, really important. I'll touch on that a little bit more because I think it's something really critical to make patients happy, because in the end, you're the one who has to be happy with your results.